Trade and Convention Center. I was here as well yesterday attending the Self-Care Framework Consultation session. Basically what that is Health Canada's looking at the NHP, Natural Health Product Regulations in Canada, and proposing changes. So we're down here today with the CHFA, the Canadian Health Food Association, and we're attending a regulatory forum as well to discuss these changes and how they affect Canadians. What I'm going to do today is I'm actually going to walk around and see if I can interview some people and get their feelings on what the changes mean to them and how they'll affect them, their families, their customers, their businesses, everything. And we'll also talk to Health Canada. I don't think they'll give us any interviews today, but I have talked to them and they said that they would look into doing an interview online. Or maybe in person. I think it'd be good to hear both sides. It would be good to hear what Health Canada has to say as well as what industry and consumers have to say. So we're going to go around and see if we can find some people who will do an interview with us, and we'll be posting this today.
Hugh Williams, President of Impact Public Affairs. I have the privilege of working with the Canadian Health Food Association on making sure that the rules for natural health products match what consumers need and also what is good for the Canadian sector. I think what's important is the Canadian sector is tremendously vibrant. We're world leaders in terms of the product choice, the product selection, and the product innovation. And we also have a world-class system for natural health products. I think what's exciting is that the industry is engaged and working towards making sure that the government understands that and that whatever framework we come out with really does the right thing for consumers and the right things that help the sector grow and continue to innovate for the health of Canadians.
Hi, I'm really glad to talk about this. This is an important regulatory session. My name is Donna Herringer, and I am past president of the Canadian Health Food Association. And currently, my husband and I have a company that does radio and television for the natural health product industry. It's important to us that regulation is fair, and also that it allows that our clients be creditable. And but in order to be effective, they have to be able to make claims. So what Health Canada is proposing to me is something that we shouldn't even be considering. I don't even think we should be negotiating. That's my position. We went through this almost 20 years ago. When I was president of the Canadian Health Food Association, we had products that were either in the Therapeutics Products Directorate as drugs, or they had no regulation as herbs. So we had to really convince an industry that regulation was the way to go, and it was not an easy job, but we did it. And what they describe as the enemy was the enemy then, but we won. We won because we got a fair regulation system that allowed claims as long as the evidence was there to support the claims. I believe that regulation should be pushed forward, and it should be enforced to make it effective. And without enforcement, then the regulations mean nothing. And so there'll always be people that break the laws, but the way that they have to do it is enforcement. And I think we'll have to convince an industry that we have to get back to the table to discuss cost recovery. But in my mind, we should not even be contemplating this new proposal. We should make better and enforce what we already have.
My name is Daniel Doresser. I'm a pharmacist. I'm a doctor of pharmacy in France, and I'm here the president and CEO for Boron Canada. Boron Canada has been here in this country, in this beautiful country, for more than 26 years, and Boron worldwide has been in market since 1932. So that being said, this new regulation, is a challenge because we believe that the actual regulation works well and there is no reasons to fix a system that is not broken. That being said, we believe that we can always improve in terms of labeling. We can always improve in terms of reinforcement of compliance reinforcement. Let's make sure that the stakeholders are following the rules, and we believe that we can be part of this solution. We want to be proactive. We want to provide solutions here, but we truly have an issue when homeopathic medicines will be considered and mixed with lipstick. We are here talking about homeopathic medicines regulated worldwide as a medicine. These medicines are of course, endorsed and prescribed by some physicians, homeopath, naturopath, but healthcare professionals. And considering homeopathic medicines or herbal or traditional Chinese medicines as the same level as a lipstick or a beauty product is really challenging for us. We are treating, helping patients, I say patients and not customers, when it comes to symptoms. We are not making them looking better. We are making sure that they are well treated in a non-toxic manner. And that's what matters. We know overall that this medicine, these homeopathic medicines, for example, or NHPs in general, are non-toxic, or I would say at a very low level in terms of toxicity. So there is no reasons that we should compare it to for example, a drug that has a high level of toxicity. So we get it. But why are we trying to mix up everything in the same umbrella? NHPs have, their regulation worldwide has been way in advance worldwide, and we should be proud of it. We should improve it, absolutely. Now, concern that we have are 4 unintended consequences. Number 1, the first proposal was putting homeopathic medicine at the same level as lipstick as a level 1, low toxic. But this had a consequence in terms of health claims, no more health claims. And this first and unintended consequence is freedom of informed choice. We believe it's by adding more information on the labeling and not less information that we will inform more Canadians. I see some improvement, which is good, and I feel like Manon Bombardier is listening, and this is a really good sign. That's positive. Now, the second one is cultural diversities. You have in this country here a lot of communities. I'm European, I'm French. Homeopathic medicines are used by 60% of the population. You have Indians living here, they are Canadians. You have Chinese people that believes in traditional Chinese medicine because it has been used and practiced in a traditional way for more than 2,000 years. Let's make sure that this population will get the same amount of information, will get access to these products on the shelf, and will not be impacted by any changes in terms of regulations. Number 3, I'm a pharmacist, and my major concern is health risk. By having an easy access to market, which is what we call the pre-review market access, I'm concerned about it. The actual regulations make sure that these products are reviewed and licensed. So I want to make sure that we are not, how can I say that, decreasing the level of quality of this product. Number 1. And the misuse was one of our major concerns. By removing health claims, because you are a non-toxic product, doesn't make sense. Because then the mother will not be well informed and might treat their daughters with a cough syrup when in fact she was looking for a cold syrup. The last but not the least, this industry, NHP's industries, are small and medium-sized businesses. They are not big companies that can invest millions and millions of dollars, and that a change of these regulations is really concerning for us because it might squeeze off small and medium-sized Canadian businesses, and that's important as well. So thank you, Health Canada, for being here, spending the time listening. We've seen a significant improvement over this past 6, 7, 8 months, and I want to thank Manon for that, because I see her leadership making a change, but we have a lot of work to do, and again, there are some solutions, and we want to be part of this solution. So thank you very much.
Hello, my name is Michael Bentley. I'm with a company called Sierra Cell Health. We're members of the CHFA. We're down at Expo West. I have the privilege of hearing a lot about the new proposed self-care regulations framework. It's a bit controversial because right now we do have good rules for natural health products in Canada under the Natural and Non-Prescription Product Directorate. I'm a supporter of the rules, and yet I understand what Health Canada's challenges are. We're kind of in the middle of some other categories, cosmetics and non-prescription drug products. And they're trying to modernize the act so that when there are similar products for similar situations close together on a store shelf, as would take place in stores like a Rexall or Shoppers Drug Mart or London Drugs, for example, where they're together, it can cause consumer confusion based on the not radically dissimilar claims that are presented. So I get that. And I think what we need to do is try and work with Health Canada. They seem to be open to input. I'm assuming it's legitimate at this stage. I think we should be working with them to see what we can do to ensure that our current rules, which are good, which are considered for around the world to be really good rules, to be fair rules, to see that they can be effectively incorporated in what Health Canada is doing. I do have a couple of issues that I think we should be aware of. My concern with what Health Canada has presented is both an opportunity and a concern. We're missing a lot of information. And that's an opportunity because I think Health Canada is generally open to receiving input to how they can make what they're doing practical. As part of what we saw yesterday and today, my concern would be in some cases maybe even dumbing down the natural health product regulations that we have right now in order to reduce the bureaucratic requirements in terms of registration. To me, that would be a mistake because I think it would cause more confusion for consumers to have a class of products that are registered with Health Canada. They get a number from Health Canada, but they're not necessarily approved by Health Canada as another class of products may be. So I think that's an issue. I think we need more clarity around a potential appeals process when a company has a different perception of how their product is reviewed than Health Canada has. I would like to see that actually independent. Right now the review process reports within the structure of the natural, within Health Canada. I think there should be an opportunity to consider a review process that might be independent, would report independently through the health minister to make recommendations that Health Canada would then need to respond to. Some other thoughts around it is one of the issues that they raised is quality control within our industry. And I don't know of a company that doesn't want to do a good job on quality control. I think that's very uniform. But I think the challenge is with the sophistication of the testing methods today in terms of testing for the potential broad range of contaminants that can be there. Whatever is true for us is also true for food products. And one of the things that I have communicated to Health Canada is whatever they do should be a level playing field so that they're not creating a discriminatory environment against natural health products in terms of safety requirements that wouldn't necessarily have to be met by a food product. If you're importing a spice, are you testing it for pesticides, for example? And so we need to ensure that it's not just a level playing field amongst what I'll call the auxiliary products, the cosmetic products, the natural health products, or the OTC products, but among all products if safety is truly the primary concern.
Hi, my name is Terry Vanderheyden. I'm a doctor of naturopathic medicine, and I work for the natural health products industry as a consultant, specifically with a company called St. Francis Herb Farm that manufactures herbal products. So we're here at the CHFA, Canadian Health Food Association trade show, and there's a session today put on by the CHFA, and the Natural Health Products Directorate has come to speak to us about the new proposed regulatory regime, their proposed self-care proposal. And so my issue with the whole proposal is that it's very short on detail. We have a regulatory system in place at the moment that seems to be working very well, with plenty of oversight in place. It's considered world-class, well-recognized worldwide as maybe even the most well-respected regulatory system that exists. I really don't see the need to revamp and completely overhaul a system that quite frankly seems to be working, and that our company has spent literally millions of dollars complying with as far as man hours, quality control measures that we've brought in place, which I think have all been very good for the industry. Quite frankly, I think the industry is doing very well. We simply don't think, Health Canada basically says that, trust us, and I just simply find that a little bit hard to swallow, and I think the system should stay as it is. Certainly there are some, it's not perfect, there are those things that could be improved upon, but to completely rebuild a system seems completely unnecessary to me. So.
We got a few good interviews today, and at this point we're going to show you Safe, Effective, Trusted. This is the banner that's at the show. But if you want to know more information, there are still some more sessions available. April 20th in Yellowknife, April 24th in Montreal, Quebec, April 28th in Halifax, Nova Scotia, May 2nd in Toronto, May 3rd also in Toronto by the airport, May 5th is a WebEx consultation section for English, and May 5th as well later on in the afternoon is a WebEx consultation in French. So if you want more information, visit chfa.ca/register.